Now the other question was, will the start date for funding begin July or October? I don't answer for that question. It really depends on what is historically a massive process, in order to get it done. And typically they start October 1st. So that is what my guess would be. If for some reason it got done much sooner than that, they may opt to do it in July, but highly unlikely. That's the Q&As. I think this is being taped, so that should be okay for people, that it's fair to everyone. Our current MHI grantees awarded in 1999, 2009 eligible? Yes, and that was not addressed, and Diane just addressed that one. If a jurisdiction has received a grant before, can it be a targeted jurisdiction, maybe not under a statewide proposal? Well, I'm not sure I understand what that one meant.
I think saying that if they're an entity who has already applied and gotten a grant for one particular population, may they apply again for another targeted population? And the answer is no. Not
if you're currently receiving a system of care expansion, implementation, cooperative agreement, or an expansion, if you've ever received funding for the planning, then you can't. But that's the limitation. Okay, thank you. You're welcome. If you currently have an expansion implementation grant, you may not apply for a second one. Okay, that is the one limitation that we have, because we want to be fair and give others a chance to apply for the implementation grant. So you cannot do that now in a parallel or different way. If as we're saying, perhaps in the future there will not be a limitation, but currently funded system of care expansion implementation grantees are not eligible. A lot of other, I see, everybody's just getting disconnected here. Expectation for bringing systems of care to scale if the proposal is from a state agency. Again, you need to develop and share that so that our grant reviewers understand it. Our goal is to promote SAMHSA's theory of change and to create a strategy whereby systems of care is the preferred approach. Who have serious mental health challenges. So being said, that is, I think, for the most part, all of the questions that I can garner. If, in fact, that you are in questions, you can email, particularly, I think, on the RFA, you can see where to email. If not here, the answer. Okay, if it says, if you are in historical, traditional SOC grants, at the very bottom of the eligibility, there's no restriction on recipients of original CMHI awards between 93 and 2010. So yes, you can apply. Can you repeat a question about having a current agreement and eligibility? I'm not sure. Okay, that answers. Yay, okay. All right, so I've gone well over, so my colleagues are going to have to really contain what they're having to say. But again, that's sort of part of what I try to do, is to set the stage and then respond to these critical eligibility and RFA process questions to give everybody an opportunity to do the best job that they can in order to get funding. We're excited to do this. I want to thank all of you for your amazing interest in here. It looks to me like we have over 250 or so people online, and I'm just very grateful, and lots of good luck to everyone. Thank you very much. And now, without further ado, turn it over to my colleague at the Technical Assistance Network, Denise Salzback. Denise?
Gary, and I'm just going to ask, this has certainly been one of the most entertaining and eventful webinars I've been on. I'd ask all the participants to please mute their lines again, because we have had some feedback since folks have had to call back in. Thank you so much. It's *6 to mute your line. And with that being said, I'd like to first acknowledge that the suggestions that I'm going to share with you are applicable to any RFA. And while I will be giving some examples from these RFAs, they're not intended as specific guidance for these RFAs, and I'm not representing SAMHSA or grants management. And with that, let's get started. So we'll first want to do a broad review of any RFA in order to decide whether or not to submit a proposal. Prior to actually sitting down and planning and writing, you will want to do a complete read of your RFA from beginning to end. You really want to get into the weeds and know what could be lurking in those weeds before you start planning and writing. A basic list of checklist of factors you want to consider in determining whether or not to submit an application include ensuring that eligibility criteria is met. As Gary mentioned, that the applicant agency has a DUNS number and is registered with grants.gov, that the required approval and sign-off is attainable, for example, the letter from a governor, that match is identified, that the required partners are committed, and most importantly, that the submission deadline can actually be met. Slide. If you've made your decision to submit, you want to use the section titles and bullets in the evaluation criteria, and Gary's referenced those a few times, as the outline for your response. I actually suggest that you consider copying and pasting the evaluation criteria from your RFA into your working draft. This will help ensure that you hit each criteria and keep you from having to flip back and forth between your draft and your RFA. The bulleted criteria can come out and be replaced with headers or paragraph lead-ins once you're satisfied that you've addressed each bullet. And the evaluation criteria tells you the what that the reviewers will be looking for. You also want to pay particular attention to the funding opportunity sections, which include purpose and expectations, eligibility information section, and the application and submission information sections. These sections should serve as a guidance as to the content that you want to make sure that you weave into your response to each applicable bulleted criteria. For example, the purpose section should guide your response, showing your understanding of the funding opportunity. Next slide, please. You also want to consider creating a checklist to recognize and include focus. If you don't nail this one, your application is going to be dead on arrival. Required and allowable activities, considerations, data collection and performance requirements, grantee meeting requirements, and there are some specific in this RFA. Funding limitations. For example, these RFAs have % limitations for data collection and evaluation. Staffing and provider requirements, match requirements, most important, as well as post-award requirements. These list of requirements are often found in either the expectation and or eligibility information sections in RFAs. As applicable, you really want to try to recognize these requirements as you write narrative, your timeline, your budget, and or your budget budget justification. Next slide, please. When you reach the stage when you're actually ready to start writing, it's important to remember that reviewers will be reading many, many, many different proposals. You may be able to engage the reviewers. You want to be able to engage the reviewers and keep them awake. Try to structure your narrative as a story of your system of care. Consider introducing your partner agencies, governance, etc. at the beginning of your story as your characters, and try to avoid long and confusing acronyms. For example, if you have a ridiculous number of letters that are describing, say, child welfare or juvenile justice, just refer to them as your juvenile justice or child welfare authority. You want to fully explain and draw the reviewers into your plot so that they can see that grant award as your happy ending or the beginning of your next sequel in your system of care. It's particularly important to make sure that you follow the evaluation criteria bullets that we discussed earlier. As Gary pointed out, if you will not get the points, you don't want to put it in your story. Even if you feel it's like the best stuff you've ever written, if it's not going to get you points, don't put it in. In most RFAs, there is overlap and duplication in the evaluation criteria from one section to another. In considering how to structure your narrative, remember your page and character limitations. Think of your narrative like a story, and introduce your characters and tell each part of your story only once. Consider using cross-references. When evaluation criteria is requesting similar or continuation of what has been previously stated. This will make your narrative more cohesive, like a system of care should be, and save space. So more specifically, if you're cross-referencing to meet our RFA criteria as opposed to pointing the reviewer to additional information found in letters of support or CVs or job descriptions, make sure you reference what you're referencing is going into a scored section of the narrative. Next slide, please. Perhaps most importantly, you really want to make sure that your story gets read. When you do a thorough review of your RFA, you need to pay particular attention to the technical requirements in order to ensure that your story gets read and wasn't written solely for your own personal pleasure. will want to be very familiar with the information eligibility sections and the application and submission information sections, including all of the appendices and references within those sections. You create a checklist of requirements that will cause your application, you want to create a checklist of requirements that will cause your application to be screened out for noncompliance. These would include accurate completion of forms, margin, font, and spacing requirements for both text and tables, and there is specific guidance in this RFA with regard to tables, as well as page and character limits. Gary spoke about this earlier, and I can tell you from experience, it can be a very sad and long day and night to discover that while your creative use of space on each and every page of your application, you've managed to meet the page limit requirements, but you've exceeded the character count, and you will not be able to submit for electronic submission. You save hours of last-minute cutting and by tracking your character count in addition to your page count throughout the writing process. Next slide, please. Please never underestimate the amount of time it takes to wrap this up and satisfy all of the other RFA requirements and get your application out the door. You really want to make sure that you set aside sufficient time for obtaining letters of support. And while it takes time to individualize letters of support, I do not recommend using the same form letter for each and every agency. To the extent possible, have your letters reflect what's in the story of your narrative and some more concrete and more believable. CVs and collecting and writing job descriptions takes a considerable amount of time. Editing to get down to character count, as I mentioned, takes a lot of time. Scan documents into PDFs, completing the federal forms. Finally, the approved budget, especially when match is needed. And writing the budget justification, you really want to look in the appendices and make sure that you have that correct, and that does take significant time as well. And getting the application through agency sign-off as well takes time. With that, I'm going to hand it off to Beth Struhl. She is the president and co-founder of Management and Training Innovations and part of the team at our colleagues, the National Technical Assistance Center for Children's Mental Health at Georgetown University, who will discuss with you strategic framework and tools for system of care expansion. Beth? Melissa, we can hear.
Very much, Denise. I really appreciate that. And if you'll get to the next slide. My goal here is really to take a step back from some of the requirements and technical aspects that you've been hearing about first. The grant writing is extraordinarily useful, and there are a lot of requirements about who might apply and how various entities and other work that you've been doing fits in. But my role here is to try to put forth a framework for thinking, a broader framework for thinking, think about what is expansion, what is expansion planning and implementation, and how does that fit into the goals and the work that you've already been doing and the groundwork that you've already created in your own states and jurisdictions. So first question I think people need to ask when they're looking at this is, what is it that you're trying to expand? And when you talk about systems of care, we know that there have been a lot of definitions floating around out there, and there's been some recently updated definitions that I hope all of you have been able to see, and if not, we can make them available on the website. But I like to think about systems of care at their very most basic as an array of services and supports that are supported by an infrastructure and guided by a philosophy. That if you're trying to expand systems of care, this is what you're looking to expand. You want the services out there, you want an infrastructure to support them, and you want the system of care philosophy with core values and guiding principles that are in place to guide all of this work. The next slide. Now, the background to all this, and Gary touched on this already, was a federal system of care program that provided funding for many of those dots on the map that you saw. And that program, which continues, is a prime example of one that was not intended to just create a few systems of care, or many now, in those communities around the country that essentially are now dots on the map. The goal was much bigger. System changes that would be sustained, system changes that would have a much broader impact across states and tribes and territories, and ultimately the world. We might as well set sites really big. And this, as Gary noted, this is consistent with the theory of change. Move from innovation to widespread adoption of approach that's been demonstrated, that's been tested, and ready to move to wide-scale implementation. To set the stage for this, we did a study, Effective Strategies for Expanding Systems of Care, And we looked at 9 states that had already had considerable success in that and came up with a strategic framework that has 5 core strategy areas. And I think it's important to note that this is a framework that can be applied to the in health and human services, as you might take this from innovation all the way to widespread implementation. And the next slide. So here are the 5 core strategy areas: policy, regulatory partnerships, expanding services, financing, training and technical assistance, and generating support. And in those 5 core strategy areas, we identified sub-strategies that look at the various kinds of activities and sub-strategies that can be applied to achieving the various expansion goals that you may identify for your own state or jurisdiction. Next slide, please. To just highlight a few of the sub-strategies in each of these areas so you can see what we took a look at, and the ones that rose to the top as the most effective strategies where states have gotten the most bang for their buck in putting efforts and in putting their resources to look at how this can be expanded much more broadly. A locus of accountability at state and local levels. This is who's responsible for systems of care, for starting, for overseeing, for evaluating. Interagency partnerships, rules, regulations, guidelines, and requirements are an important part of a larger strategic plan, because it's in combination with various kinds of incentives, rules and requirements, and putting this in monitoring protocols, really get the lesson out and make it clear, and set a framework for the communities within the jurisdictions to understand what is expected of them and how the system is moving, what the directions they're moving in. Data systems, of course, important, and increasingly important is a strategy around linking with other system change reforms. We know they're occurring across all child-serving systems, but now, of course, the ACA has a lot of opportunities for financing, and important to link those in policy work of expansion. Next slide. Services and supports is the second area, and it really involves expanding the array of services and supports, looking at individualized, tailored, customized approach to service delivery, which most of you know is wraparound, implementing values like family-driven, youth-guided services, care coordination, a new provider network that's expanded with different providers, evidence-informed practices, Gary mentioned, clinical excellence, cultural competence. All those relate to expanding services and supports and our strategies that the successful states use to achieve that. Finding the one strategy we found to be the most important was Medicaid, Medicaid, Medicaid. We also found strategies by states in using grants, and particularly in an era of tight resources, redeploying funds from higher cost to lower cost services has become a very common and effective strategy that states have used around system of care expansion. And next slide. So the next area is around training and workforce development, and a number of the strategies used in the states we studied, not only providing training on the system of care approach or evidence-based practices, but also on creating ongoing training and TA capacity, such as centers of excellence or institutes of various types that are sustainable, ongoing structures to provide training throughout the jurisdiction, throughout the state, with the skills and with the knowledge needed to continue the expansion process. And next. So generating support is the fifth of the core strategy areas, and this really amounts to social marketing and strategic communications. The strong family and youth organizations have been found to be essential in making the case for system of care expansion, and also support high-level policymakers and administrators, we've found that probably that's one of the single most important factors in making sure that this work can occur in your plans and when you move on to the implementation phase, and coupled with that using data on outcomes and more recently on the return on investment in system of care development. And there'll be a lot more resources coming out very soon on how you can think about return on investment and how you can begin to pull together some of that data to make the case with policymakers in your state. Next. This is an infusing system of values throughout the planning process, throughout implementation, and the core values, as you know, family-driven, youth-guided, cultural competence, cross-system collaboration. So you use the framework very quickly in creating your plan. A number of the states that have done planning grants have used the framework by first creating an overall approach to expansion. I think this is critical before you sit down and write an application. You have to think about, how am I approaching expansion? Am I doing it geographically? I'm going to start in a certain number of areas and then systematically expand my work to other geographic areas so that there will be a sequential rollout of some of the new service approaches and systems of care throughout the state. Are you starting with a particular age band, early childhood or youth and transition? Are you looking at the most high need children in a jurisdiction? And many of the states and communities have done that, those at high risk for out-home placement in residential treatment or inpatient or such. So an overall approach is probably the first step that you have to think about for the expansion. And the slide shows that after you have, next slide, after you have identified what your overall approach is and identified some goals, you can use that whole core strategy framework to array in each of the 5 core strategy areas what are sub-strategies that you need to achieve that goal. This was taken out of one of the plans from one of the first grants, and it showed how they wanted to expand services for transition-age youth and what was needed in each of those areas to accomplish that in a plan. Next. We did analysis of the first cohort of grantees, and I thought it would be interesting for you to hear just a couple of those things. They felt stakeholder involvement was particularly successful in building partnerships with groups and stakeholders that had tremendous influence. TA, important to take advantage of that. Creating and proposing in your applicants strong, skilled leaders of the process and some very good planning structures with perhaps a great representation and then some subcommittees. And the next slide shows that there were also some challenges, and you can appreciate some of them. I'm sure you'll have all experienced it, I think, for the plan grantees. And what you have to think about in your applications is that startup is fast and the time frame is short, so you have to think about that when getting going. And the next slide shows that we identified a number of factors that enhance successful implementation of your plan, and this is something also that you have to think about when you're creating your plan. I would take a look at this very closely. We're not, I think, looking for pie-in-the-sky plans. Goals have to be realistic. Strategies have to be concrete. You need to have some priorities. You need to have some commitment from on high, and you need to have some strong leaders and partnerships. So these are the kinds of things that you need to lay the groundwork for in your application process, and you'll be ready to move along successfully afterwards. Next. Challenges, and I'm sure you can anticipate what they are. Again, commitment workforce was a big one, fiscal crisis, but again, the idea is from the beginning of planning your application, look at these challenges and think about how you can address them starting with your application. Next. Keys to successful expansion: you have to have a team, you have to have a plan, you have to have priorities, and you have to have commitment. commitment. The one thing I would say here is this is not a project, and when you write your applications, don't call it a project, because what this really is sustainable system changes that want to improve services and outcomes and make the system of care approach the way the entire child-serving system and your partners do business in your jurisdiction. So it's not a project. This is not something separate from your system. It has to be integrated into your system and, in a sense, shape your entire system and how it's going to do business moving forward. Next. There are rules ending that I'd like to mention for you that I think you could find useful. One is a logic model that shows planning and implementation as phases of this expansion process. Is a self-assessment of strategies that you can use as readiness assessment. You're not required to use that. There are others that you can use to fulfill that purpose, but many of the jurisdictions have found it useful to begin the planning process. And there are quite a few tools for planning and implementation. There's a guide for planning and some templates. There's an implementation guide that has a lot of information, and those are available to you, and you can certainly get them even now to help you look at what's required, what guidance has been given to the grantees, and how that may help you think about what you want to put in your application. Next. This is a logic model, and I think it just shows you how all of this fits together, that there are some inputs that you do your strategic planning that leads to some implementation activities, and I think you can see the 5 core strategy areas interspersed in there, and then you expect outcomes at each level, the jurisdiction level, the community level, child family level, and this is just a way as a logic model to put it all together as to what we're thinking about in terms of expansion planning and implementation and what the outcomes would be. And next, one more tool that I wanted to mention to you, and this is a rating tool for implementation of the system of care approach that was developed specifically to make progress in implementing systems of care, and it can be used to measure the progress toward system of care implementation in communities and to provide feedback about technical assistance needs and strengths and areas that need attention there, but also aggregated up to a jurisdiction, a larger jurisdiction-based level across all the communities, the multiple communities in the jurisdiction. How many are progressing up the multiple levels of implementation? And a number of states are now using this, who are in the implementation grant process and looking to measure over time annually probably what their progress is, since the goal, of course, is expanding systems of care. Here's a way that can look at the extent to which those systems of care actually are being implemented throughout the communities in jurisdiction. And next, I think that might be my last slide. So with that, I would like to turn it over to Anna Maria Brennan, who's been a colleague for many years, and welcome you, Anna and Westat, as the new evaluators for the expansion planning and expansion implementation grantees. And we'd love to hear what some of the plans are for that evaluation.
2000.
I think Linda
Got to be involved.
got to do some writing. I just
Yeah.
started.
Start muted. Hearing a lot of planning going on already.
Sorry, what I'm going to do is I'm going to mute everybody, and then the presenter, if you could just press #6 to unmute yourself, then everybody will be muted, and then we can just move on from there, okay?
Thank you.
To your line,
Okay,
press
folks.
*6
this is Anna Maria
or
Brennan.
#6.
I'm at Indiana University. I'm serving as principal investigator through a subcontract with Westat, who is the contractor for the national evaluation of the expansion and implementation, expansion and planning, plan implementation expansion grants. Next slide. Next. So the purpose of evaluation is to take a look at systems care following the ideas and approaches that have been mentioned already by Gary and Beth, to see how folks are expanding their systems of care under two initiatives, the System of Care Expansion Planning Grants and the Implementation Cooperative Agreement. So both of them fall into the evaluation. And this is a cross-site evaluation. It's standardized so that we can make comparisons over time as well as across grantees. And we'll also be able to provide some more information, we hope, about what, how to make a system of care, how to successfully expand a system of care, bring it up to scale, and sustain it over time. Next slide. So we're supporting communities in their compliance, I'll call it, or their contribution of child and family track, data collection, and other kind of reporting requirements under track. I'll also be examining how much the system of care expansion efforts, system of care values, the family-driven, child, individualized, confident those values, integration across agencies, that sort of thing, and the extent to which there's a true spread of systems of care across a broader geographic area, if that's the goal, or to underserved populations, if that's a goal of the grant as well. We're interested in the intersector collaboration across at both the administrative level, kind of at the jurisdictional level, as well as at the local service system level. And we'll be identifying and documenting the mechanisms and strategies that systems of care are using to implement and expand their efforts. Next. Think of this as, Beth talked about this as well, that there are three kind of levels that folks have to concern themselves with as they're developing their systems of care. We'll be evaluating at those levels explicitly. So jurisdictional level is, across the whole geographical area, that kind of broad area. And we're going to be concerned about how systems of care are organizing themselves and what kind of mechanisms and strategies are in place for that expansion, as well as the efforts to support local service delivery in a way that is keeping with systems of care principles and all of the other values that we pursue here, through the system of care efforts. At the local system level, we'll be identifying the procedures, the operations, kind of the rubber meets the road kind of things that folks are doing at the local levels to expand systems of care, to make sure that good clinical processes in place, and other kind of service issues that are important. And at the child and family level, we're going to be able to get enough information from you folks on, you guys will be contributing data, grantees will be contributing data to be able to describe the population that's being served, as well as to try to track outcomes over time and to see how families and children are actually experiencing the systems of care. Next slide. I'd like now to introduce Jane Tobler, who will be talking to you about social marketing. She's with Vanguard Communications. Very good.
Stand by. Not arrived. Please stand by. You guys hear me? A little bit. I don't know what's going on. So you heard any of my part, but this is Jane Tobler with the Caring for Every Child's Mental Health Campaign, and today I'm here to talk a little bit about social marketing. And so what you want to think about is, in social marketing, one of the tenets is think about your audience and what's in it for them or what's in it for me. So when you think about social marketing, there are different pieces of it. There's the goal of what you're trying to accomplish, the audience, who is you're trying to influence, the message, what will appeal to them, channel, how will you package it, how will you deliver that message to them, partnerships, activities, and materials, what are you going to do, how are you going to do it, and pre-testing, again, making sure that everything is culturally competent, it's relevant, it's actually going to speak to your audience. And one of the important things to think about when you're working on social marketing is cultural competence, because to be successful in doing social marketing and implementing social marketing, you need to be culturally competent. And the other thing is that social marketing is important to you because it is a deliverable. And when you are applying for the planning or implementation grant, you are required to either develop a social marketing plan or implement social marketing. Next slide, please. Social marketing is a process that applies marketing principles and techniques to create, communicate, and deliver value in order to influence behavior. So you want to think about what is it that you're trying to change in your state, in your tribe, in your jurisdiction. What are you trying to change? What do you want to replace it with? And social marketing is also a process for creating, communicating, and delivering benefits that an audience wants in exchange for audience behavior that benefits society without financial profit to the marketer. Again, we're thinking about what do we want to do right now, from now on, in what we're doing. So what are those things that are important? How does it matter? Next, please. So my colleague Beth Struhl spoke about generate support through social marketing and strategic communications, the importance of the success factors that four RFAs in front of you have done. I think it's to discuss those, what those things are that social marketing can help you with, what well and what didn't. Additionally, benefit from marketing include cultivating strong interagency relationships, involving stakeholders, establishing a strong family organization, and using evaluation results. When you're expanding and when you're planning to expand. Next slide, please. When you think about expansion, you need to think about who is going to help you expand. What partners are you going to need at the table? What agencies? What leaders? What do they need to know about what you're trying to get them to do? Denise earlier talked about telling a story. Well, this is the story of what you're trying to do differently for children and for families in your state or your tribe or community. And should they partner with what's in it for me, what's in it for them? Why does it matter to them? Why should they come to the table? Why should they help you? Why should they plan with you? And how you ensure leadership changes, that partnership is strong and sustained. It can just be the very top person in an agency or in a different partnership, if it's in education or in JJ or, with different areas. You really need to think about that when the leadership change, will it remain strong? Why will it remain sustained? How will we indeed help expand? So in this slide, you think about what we've gone through. Where does your audience exist? Where do they lie on these? What is important to them and where are they? So if you think about an agency that you need to bring to the table in order to collaborate with for success, are they aware of the values and principles? Do they have an understanding? Are they interested? Do they want to learn more? Or are they fully supportive? You need to think about those groups, put them in those boxes and figure out, one of the things for marketing is to help figure out what motivates them to embrace it more fully, to be a collaborator that doesn't just sign online, but in fact is with you. So her slides, she can talk about the success that you generated. Next slide. So social marketing facilitates partnership development, and talked about the importance of leaders, also staff, and volunteers. Audience engagement, awareness building. So we know that systems of care meet the needs of children with serious mental health challenges and their families. We need to make sure that message is heard loud and clear. And mental health is fundamental to children's overall health and well-being. Important pieces that you're going to talk about in your tribe, in your state, in your community. Next slide. So, excellent opportunity for you to engage in this is National Children's Mental Health Awareness Day. This year it will be May 4th, and we'll have a kickoff event on May 6th. Oh, it's May 8th. You guys can read that slide better than I can. And finally, the Caring for Every Child's Mental Health team. Next slide, please. Partnership with the National Association of State Mental Health Program Directors, National Federation of Families, as well as Vanguard Communications. And I will introduce Lacey Kendrick Burke, who, aside from being an amazing person and talented woman, is also the Executive Director for Youth Move National, and she's going to talk about youth involvement. Lacey.
Okay, great. Thanks, Jane. Assuming people can hear me. So I'm going to talk about youth involvement. Not only give a little bit about what it is, but why it's important and how to try and include those that in your application and in the practices that you're going to be doing and implementing afterwards. Slide, please. I involve youth. It can take a little bit more time. It can take a little bit more work and be a little intensive, but it also has a great reward. Not only is a primary principle of system of care practice and value, it's also a required component of the applications. And so really want to pay attention and make sure that your youth-guided practice is very clearly written throughout your applications. Also, initial research and evidence supports more positive outcomes result when young people are authentically involved in the development and implementation and practice, and that affect them, and also when youth-guided principles are embedded throughout. And then nothing of us without us leads to more meaningful engagement, and that just means that as young people having been involved in the system and being involved in systems development, we know that it works better when we're involved, and we know that we have better interpersonal outcomes for ourselves and for other young people when we're meaningfully involved in the development of the systems that involve us. And so not only does research show it's required, it's good practice, but we know that it works because we see it all the time. Next slide, please.
Real quick, Lacey, sorry to interrupt. Can you hear me?
Yes.
Okay. For some reason, people keep getting unmuted, so I'm going to mute everybody again. And then if you could press #6 to unmute yourself, and then we can continue. Okay?
Great. I hear me now?
Yep. Great.
Okay. So just a little bit of a brief overview of the definition of youth-guided care. Youth-guided care is defined as young people have the right to be empowered, educated, and given a decision-making role in the care of their own lives, as well as the policies and procedures governing care in their organizations and or communities. So that only means that we have a right to be empowered, we have a right to be educated about what's going on and about the systems and services that we're receiving, but also that we have to be given a decision-making role in partnership with the people that are providing and developing those services, not only in our own lives as an individual. So, state level of the policies and procedures that affect the systems that we're involved in, or the organization or program, or even our communities. And this also not only includes listening, but implementing. With hearing from young people and including that feedback. That's also a really important part of the CQI and evaluation process, is making youth and families are involved in process as well. Not only in the, when application, you want to make sure that young people are involved at all levels, but also in the evaluation and CQI process, and that's a really important piece too. The next slide, please. Look at strategies for expanding youth-guided care. Really important to build on what you already have. It's going to show a lot if you already have some strengths in your community and in your system that you can expand on and utilize and apply those strengths that you have already to want to expand. A good way to do that is to partner with whoever the current youth engagement coordinators are, the current users. If they're not specifically related to your system, I would still encourage you to reach out to whatever groups there are that have been involved. Maybe there's a advisory board with the child welfare system that you can engage in your system of care if you don't currently have a strong youth advisory board. And you do want to include at every single level. So I say this often, but for every youth serving system or program, there's capacity at every level for authentic youth engagement and partnership. And so that means that when you're thinking about what entry-level services you're wanting to do, you want to think about how young people are going to provide that, especially for your transition age young people. How is it going to be youth-guided and youth-driven care at the service level? Going to be at the program or community level? How are going to engage young people or groups of young people, or their youth engagement coordinators and support people in that process at that level? And how are you going to incorporate youth voice at the systems or policy level? So all of those levels should be addressed in your plan, not only for the application, but for when you're implementing and expanding your system of care. So, a lot of resources that I have found helpful in the past when trying to make sure that youth-guided principles are in every what an organization or a system. And several of these, all of them are available for free. Some of them have been developed in the past. Some of them are specific to small components that should be present when you're engaging young people in your expansion. We make sure that we work from a youth-guided approach into a youth-driven approach and build up into a full youth-adult partnership. And so, if you have some of those components currently existing, make sure that your plans include how to expand and how to build on what you have until you get to a full youth partnership at every level that we saw on the slide before. And these slides are going to be available afterwards. So if you want to these resources are there. We're also available to answer any questions on how best to implement youth-guided care in what you're doing. And I do want to point out that young people can provide really critical information, even if they can't write a big proposal or be involved in that process. You can do things like focus groups or, just very formal conversations even. And so there's a lot of resources here on this list that can help with that process. Now to turn it over and introduce Sandra Spencer. She's the Executive Director of the National Federation of Families for Children's Mental Health. She'll talk about how family-driven care can support everything that I just talked about and more. Sandra?
Thank you. I'm going to be talking to you a little bit about family involvement. So can we get the next slide, please? Family involvement has been around since the inception of systems of care, and it has really come a long way on a continuum. So as you've heard from many of the presentations, we often now say family-driven care, but has evolved over the years. For example, in the guidance for applications that given talking to you about and all the eligibility criteria, from 1993 to 1999, we only talked about family involvement, making sure that families were there and families were involved. Then around about in the year 2000, we changed the language and we started talking about parent-professional partnerships and more deeper level of family engagements. And then in 2005, in the guidance for application, we really started to use the language family-driven care. So next, please. So you can see from this graph, we started with family involvement, and that meant that families were included to participate in systems of care. They were involved in many levels, but the involvement was not very significant. Members were given some kind of support to come to planning meetings, such as they were giving gas allotment and help with child care, and sometimes transportation needs were met. We really started talking about family engagement. And family engagement meant that families were more engaged in the planning processes. They were engaged in multiple areas and levels of system of care that Lacey described. and they're having some impact on systems of care and the development. Some members would have more access to the meetings because people would schedule the meeting at a time that were more convenient for family members. Families had an opportunity to give more direct input, not only from their voice, but from the voices of families that were also in their community. But we realized that we had to move to a deeper level of family engagement, and that's when we started talking about family-driven care. And then C, the definition says that in family-driven care, families have a primary decision-making role, but not just in the care of their own children, but also in shaping policies and procedures that govern all children. So they really have a strong voice in governance and management of systems of care throughout the system. Families are really validated for their time and their expertise, and they really are, you see them involved in every area, on boards and work groups and committees, and just extremely essential throughout systems of care. So what does this mean for you as you do this application process? Next slide, please. The application process, it means that families have to be involved from the start. So even that you're thinking about applying, you're developing concept, you're going to do what Denise talked to you about how do you tell your story, you're going to make sure that families are completely involved. So families need to be involved when you start talking about choosing culturally and linguistically competent support and services and who your partners are going to be with that, talking about your array of services and your providers that you're going to be putting in your application. When you're telling your story around setting goals, what do you want to do in your application? What are your goals? Families should absolutely be at the table. When you're talking about designing your system of care, or design how you're going to do your planning, implementing it and evaluating it, families should be involved from the very start. And then monitoring outcomes. Who best to tell you how things are going than families who are in your system, who come from the communities, and can really tell you whether you're being successful in your attempt with what you're writing, if those things are going to be successful, and then when you start implementing. And then also, families really need to be involved on partnering and funding decisions. Because you write your application, as you start thinking how you're going to implement systems of care, you need to make sure that you're funding things that are going to help you to be successful. For example, make sure there's ample resources for family-run organizations and family partnerships. The other thing that's important is the help of certified parent support providers. And this is something that's highly supported by SAMHSA, and it's something that's been successful in the past. Next slide, please. So parent support providers, we're talking about parents who have the lived experience of raising a child with mental health issues. They also have the lived experience of dealing with multiple systems, and in systems of care over the years, knowing what works and what doesn't. And so families can be in a mentoring role, not only mentoring other families that they would do as a parent support provider, but helping with the leadership of your system of care that you're building. Speak from experience about what worked and what didn't work. They can participate in modeling and coaching. Families can be hired in many positions throughout systems of care. They can be a part of shared decision making. They can do the modeling and coaching not only for their family partners, like I said, but all of the partners that will be involved in your writing and your implementation and your evaluation process, and then teaching and coaching. We know that families are really involved in helping other systems partners, their other family and professional partners understand the concept of systems of care, family-driven care, and they really help you with your cultural and linguistic competency piece because they're a population that we're really trying to be culturally competent to. So they help us with all of this information and to process it. So even right now, as you're starting to think about whether you're going to put one of these applications, think about what family leaders you can get involved. You do this by finding a family organization, a family-run organization in your community, in your state, in your jurisdiction. You get help with that by visiting the National Federation's website because we have chapters all over the country, and you can find a family leader who will really help you write a very great application. Next slide. So I'd like to introduce to you Mario Hernandez. And Mario is a professor at the University of South Florida in the Department of Child and Family Studies, and he's also a partner with us here at the TA Network. So Mario, I'm going to discuss with you guys the cultural and linguistic competence portion of our work. Mario.
People need help to help make the decision. Anybody? Okay. I'll go through it with whomever, and I'll go through all of it, and then I think by the time we're done, we'll have a good idea of what People like to call and take this slide. You can't get a hold of it. I also have I mentioned him before, an individual in mind for involvement.
Oh. Hello?
Hello?
Yeah. Can you hear me? Next.
Yan.
Okay, somehow. Can you change the next slide? Okay,
sure, if they want
here we
to
go.
hear them.
All right. I'm not sure what, everybody can hear me now. I'm not sure what, whether cut off or not. But anyway, let me move on. The part of the RFA that's focused on cultural and linguistic competence is really about reducing disparities and trying to find ways to better serve underserved populations, better access, service use, and having better outcomes. Specifically, applicants who would want to identify subpopulations within their cities, jurisdictions, all the geographic areas that we've talked about that are vulnerable to or are already experiencing disparities. The things that I think is important to remember is to not just refer to national statistics on this, but to show the ability to understand your jurisdiction or the geographic area that you're concerned about, and numbers that you may have within your state or within your community to support that you are connected to vulnerable populations or to populations experiencing disparities. You create strategies, plan them or implement strategies that decrease differences in access, service use, and outcomes. Eventually, you will develop an impact statement, a disparities impact statement for use of data for outcomes that is related to race, ethnicity, LGBT status, plan for adherence to class standards, and also to use cultural competence in your social marketing, which is really important as a way for reaching vulnerable populations or unserved populations. Next slide. Strategies for achieving cultural and linguistic competence include collecting data, planning data, and implementation data that's relevant to achieving cultural competence. Quality improvement planning that's based on that data, but that aggregates by population so that you're not just looking at large groups of Latinos or African Americans or other populations, but that you're looking at those populations based on where they live. Not all populations, even when they share the same culture or race, are experiencing the same kinds of disparities. So show the ability to understand the diversity within the diversity. Also having strategies for recruitment and retention of diverse staff, how you plan to hire, how you plan to retain people through training and support, how you plan to evaluate and reward folks who are doing a particularly good job of serving diverse populations. Also, it's important to remember that we also, while we want to recruit so that we have better, so that diverse children, youth, and families have access to services, we also want to make sure that we're retaining folks at the same levels that we retain other folks. And that's why the quality improvement plan needs to be disaggregated by different groups. Also, engagement with all communities and populations of importance to eliminating disparities. Communities actually live in neighborhoods. Other communities, like LGBT, live across neighborhoods. And so you engage with those in a way that's meaningful to their participation in any of the same ways that Sandra was speaking about with families. Next slide. I want to give you this definition of Healthy People 2020. I'm not going to read it all, but I want to focus on that health disparity is something that adversely affects groups of people who have systematically experienced either social or economic obstacles to their health care or their mental health care based on racial, ethnic, religious, socioeconomic, all those reasons on there. They're all the populations and communities that are in that community that you need to be connected to and reaching. I think it's important to be clear in the application of what your particular community or jurisdiction thinks of as a disparity, because how you measure it, how you evaluate it, what you look for in your quality improvement, and what you do for training all comes from how you believe and how you define a health disparity. Next slide. One of the things about the system of care approach that you've heard from everyone so far is that it's not all about the Behavioral Health Authority doing this by themselves. And I think this is particularly important for culturally cultural communities, that this approach suggests that as we work within behavioral health, mental health systems around eliminating disparities, that we should link that trying to reduce overrepresentation in juvenile justice, child welfare, and underrepresentation in certain types of education programs, both special education programs and also programs for the gifted where folks are underrepresented at times. So the idea is for the elimination of mental health disparities and the plan and the strategy associated with a plan, that it not be alone and stand alone within the Behavioral Health Authority or within the folks who are funded by the grant, but that it engages all the partners on the governance committees in all ways in terms of the people being served that are in these other systems. People of color children tend to find themselves overrepresented in these other systems, and we're truly eliminating mental health disparities. There should be some impact on those kids not moving into these other systems or moving out in a faster manner. Next slide. I'm not going to read this, but cultural competence, it's a set of congruent behaviors. It comes together in an agency. And one of the things that I want to mention here is this is just about adapting and changing services, but it's also becoming aware of your own agency's culture and how your culture and the culture of the community or the populations that you're trying to reach, how those two things come together. Next slide. And that's why there's 5 essential elements of cultural competence, and the ones here in red, be conscious of the dynamics inherent when cultures interact. That's the dynamics of difference. And for all the other ones are very, very important. I think what's often forgotten is cultural competence is understanding your culture, having your workers and people interact with families and communities, understand what they bring to the table as much as understanding what the families and the communities bring to the table. So it's where those two things come together. That understanding really leads to true adaptations, not to diversity, but to diversity, and to institutionalize cultural knowledge and have a real good capacity for an organization to do self-assessment in this area. Next slide. Now, we all heard, I think Beth talked about a lot of the adaptations of services. So, challenges that communities are all facing is the capacity of services and support. We have enough for who we serve now to begin with. Variety of services, really individualized for a particular child, youth, or family's needs. And then the quality. Are we really offering everyone the same quality of services? This is true for all populations. So in an application, it's interesting to see how are these things attended to, so that you can see how a community plans to uniquely change the capacity, the variety, and the quality of services for the populations that they know are underserved or vulnerable in their communities. The second of this is, I think, part of how you get informed in order to make a unique for how you're going to increase capacity, variety, and quality of services, and that's by actually engaging with the populations experiencing the disparities in your area. How are they engaged? Very similar to what Sandra was talking about, and also what we heard about involving youth. Who do you involve in the population? And also, just as we talk about engaging with juvenile justice, child welfare, and education, are other public and private partners who are very connected to those communities you need to reach or you want to reach in this role of eliminating disparities. And they may not be the traditional, Gary talked about faith-based organizations. There's other social organizations or clubs for particular communities. And understanding their involvement and how they're at the table is sometimes critical. Next slide. My final word of guidance is use the term cultural and linguistic competence frequently in your proposal is probably less important than explaining clearly what you plan to do to achieve cultural and linguistic competence. I know oftentimes I see the words frequently used, but when you go to see, well, what are they really going to do? What are they going to do with a variety of services? What did they actually add when they said that? What are they going to do? Who are they going to bring to the table to help them think about that? So again, use the term, good, but making it real. How are you really going to do this? What steps are you going to take if you're planning to engage people so that when you come up with your plans, it truly is something that the populations you want to serve and the communities that they're from really support. Next slide. To introduce Melissa Bob, Director of Community Development for Children's Mental Health and Youth Engagement at the National Indian Child Welfare Association. She'll focus on key considerations for potential tribal applicants.
Hi, can you hear me?
Yes, we hear you.
Oh, thank you. So my name is Melissa Bob, and I work for the National Indian Child Welfare Association. We are the technical assistance providers for the tribal systems of care. So those are the tribal communities, like the tribal governments, and then the urban Indian organizations and some consortia of tribes. So I work for the Launi system of care community. So they're in their 6th year at the moment. So I have on-the-ground experience with the systems of care and background in tribal governance. Next slide, please. So most know there's a great need for behavioral health funding on the tribal level. There are different reasons why that is the case, and there are health disparities that's a very big focus of SAMHSA at the moment, and you'll see in the application, as it was discussed, there's the health disparities impact statement, so that's something you should be prepared to work on if you receive the grant. So next slide, please. Getting deeper into the resource discussion, the in-health service, their annual budget only covers about 40% of the need out there in Indian country, despite the federal government's federal trust responsibility that was established through treaties. And for IHS budget, looking at the mental health services, only 7% of their budget cover mental health services. And tribes are not able to the relationship with the federal government for administering Medicaid. So tribes go through states in order to do that, but oftentimes they get 100% reimbursement rate. So that's a really great thing, $330. But they have to establish that relationship with the state. And states can receive mental health block grants, but tribes are not able to do that to receive those funds. And there's also, could you please mute the line? I'm hearing some wind or something. Okay, moving on. So there's also a need for child therapists and culturally appropriate services and systems. And the systems of care and circles of care are really great possibly that will help communities establish these systems and services. So next slide. The current tribal expansion planning grantees are the Ho-Chunk Nation in Wisconsin, Lower Loch Lolland Tribe in Washington, and this one I need to practice my pronunciation, Yukon Pescoquim Health Corporation. Next slide. I call them like the AHC usually. And then our expansion implementation grantees are the Cherokee Nation in Oklahoma. They all received a planning grant before. The Montana Office of Public Instruction, they're working with tribes in Montana. Wayne County, so they're receiving a grant and contracting with the American Indian Health and Family Services Organization, and they also received a grant in the past. Oglala Lakota Nation, there are some systems of care veterans there. The Mohawk Tribal Health Center, that's in Eastern Oregon. The Umatilla Confederated Tribes, and in Pasquayaki Tribe, they've received a Circles of Grant, and they have a 4-year grant at the moment, but they also received the planning grant. And Pueblo of San Felipe, they received the planning grant, and they have this 4-year grant. Now, we also work with some tribes and tribal organizations that have the 6-year cooperative agreements. Next, please. So, as you've heard, partnerships are really important when you're establishing your systems of care. And I would stress for tribes and tribal organizations to really be thoughtful about what these partnerships look like in the beginning while you're evaluating your grant application. Had some, when we had some outside grant writers help us write our grant, and in the implementation, it took some time to figure out how we were implementing it because the grant was written in a particular way. So you want to be really realistic about how you are writing your grant and how it's going to look on the ground. And these partnerships will not only be helping you on the infrastructure level, they'll be helping you with the services and support. So they could be even as small as how going to get youth to this one event, and Youth Rec might be a really good partner in that. So think of all of the little logistics about how you work with youth and families right now and how you can further support that. And I would recommend meeting with the Tribal Council at the stage, and if you're receiving any letters of support from people, have a walk through grant with them because they really need to know what will be expected of them because the process moves very quickly once you receive your grant. You have to start services within the first 6 months now, and you have a lot of different components of the grant to submit to SAMHSA. So a lot happening on the administrative level for grants management as well as on the ground. You're working with the youth and families and then working within the local government or organization on the systems level and services. So next slide, please. Eligibility, the best people to ask about eligibility would be SAMHSA, but I just pulled this from the RFA, so Indian or tribal organizations, and it's defined under the Indian Self-Determination and Education Assistance Act. Next slide, please. So organization means these things. We see this in the RFA. And if you have any questions, just ask the people at SAMHSA and they'll walk you through eligibility requirements. Next slide. Tips for tribes. I already mentioned the partnerships, and you also need some champions within your systems. Figure out on the community level who are families that you'll be working with, and who are those youth, and how do you currently reach them, and how are you going to communicate what this really big situation for systems of care. It's not a program and it's not a project, so we're very conditioned to think of grants as like, okay, we received this grant, it has a beginning and an end, and then it's gone and the staff are gone. So think of how you're going to describe this as a philosophy, as a new way of working together, however it's culturally, linguistically competent. So you have to think through messaging and explain what this is, and then work with people in your community to spread that word and start adopting these principles and values with these different services and systems. And a big component for tribes is non-pro match. So you are receiving self-governance funds, $68. Count those as non-federal match if you're not using for match for any other things, but match could be a challenging component for tribes and tribal organizations with grants. So when you're having those partnership discussions, really focus on the match requirements and talk about how you can work with these partners to count their contributions as match if it's possible. And SAMHSA does have a document about how you do non-federal match, so I recommend looking at that and getting your feet wet with the match requirements even before you get the funding. You may not get the funding this time around, but you still should start thinking about that now. And you can also, if you're not ready yet to do the systems of care and you're eligible to apply for the circle care, you can, oh wait, sorry, I was looking at the chat. I got distracted. So you can apply for circles of care and not ready to do the systems of care class. And they have an RFA webinar for circles of care. I believe that's all. And it's for questions, if anyone has questions.
This is Michelle Babel. I want to thank everyone for sticking with us through these technical difficulties. We barely lost anyone in the logging back on, and I appreciate your flexibility both to the presenters and also the attendees.
We will be organizing both the questions, the answers, all of the resource documents, and this webinar for dissemination. So be looking for that soon. And at this point, we are, as Melissa said, going to open it up for questions. So if all the presenters would please press #6 to unmute your lines. Participants, you can ask your questions in the Q&A section on the right-hand side of the screen, or you can ask over the phone. If you'd like to ask your questions over the phone, please click the hand icon to indicate you have a question. We'll call on you, and you can press #6 to unmute yourself, and we'll have a conversation. All right. How soon will they receive the slides? It looks like the question's being answered, but we will need at least a day, and hope by midweek we will have everything out to you. Because of the technical difficulty, we're going to need to merge to, what is it? Records, thank you. And so that'll take us just a little bit longer. Are there questions?
I don't see hand icons or questions at this point. Recommendation to go ahead and distribute the slides and follow up with Q&A later, and so we'll work with SAMHSA on getting this out as soon as possible so that you can disseminate to your communities. Hello?
We're not able to access the hand. We're in there, and it's not happening.
Also, if you have a question and the hand isn't happening, why don't you start by asking your question?
Contact information to make sure that we receive all the materials available.
The information via the registration, and that's what we'll be using. Additionally, we'll be working with SAMHSA to post hopefully on the RFA site, but we'll let you know. And then finally, we'll disseminate through the TA Network's TA Telegram with the link and all the information there as well. So if you are not registered, if for any reason you feel like we do not have your contact information, either through your registration for the webinar or you're not on the TA Network's distribution, then please email us at soctnetwork@sw.maryland.edu, and I'm typing it into the Q&A right now so people have that and can see it on their screen. Another question? You're welcome. Is there another question from someone?
There's a question, Michelle.
Okay.
And then from JCFN Memphis, Tennessee. Hi, guys. Please clarify that are currently funded CMHI grantees eligible to apply for these implementation grants? And I would ask that folks go back to the specific eligibility section that we had, because we have the folks that have an original CMHI grant are eligible. Not eligible if you have currently funded system of care expansion implementation grants. So if you're looking for the implementation grant specifically and you do not currently have one, then you are eligible to apply. Another question, I had to clarify how universities can be part of this. There's several ways. Obviously, the government entity has to be the fiduciary, but universities have been a part of many of our grant programs, either because they've had contracts for the evaluation component or because some universities actually have a service delivery component and have provided services. They have offered people for project director kinds of jobs and other sort of things. They have done technical assistance and training activities. So universities have been part of the CMHI grant program in many, many different ways. You see it from Frank Ryder. We have closed systems documents that provide details about meeting. That is correct, and we are going. I emailed them, and they will be part of the information that goes out through folks that have signed up for this webinar, and we'll make sure that they get on that list. So the other thing is, if anyone out there who is still available or interested, like I said, on your RFA, Diane and myself are listed. Contact people, and if there's a question that you have to follow up on, then we will similarly respond or at least get it to the right place. So those are my my responses. And thank you, Pam Brown. Despite a couple of glitches, I agree with you that it was a fabulous car and information, and we actually thank you guys so much for participating and thinking about applying for what we think is one of the most important system of care activities that we have. So thank you very much.
Any other questions?
I did have a question.
ahead.
Okay. I know that on the System of Care grants, one of the things that you're required to do is to go through an IRB and get a certificate. What about on this planning grant? In other words, you were talking about use data. Do we have to go through an IRB?
No. The planning grant is a one-year grant. The data that we collect from you related to that are through our internal quality improvement or performance management system, and then we ask some folks to do some follow-up work to get some information from you and things like that. But it's nothing that would require an IRB.
Okay.
Sure. If any of my evaluators are on the phone, I'm accurate on that. But that's I'm sticking to my answer.
The event that there was survey activity, let's say, and I know survey activity often can get an exemption if as part of that grant, then even in that case.
Yeah, and from our perspective, you do not need that to move forward. If you work for an agency that has requirements that are separate, that are perhaps more stringent than that, in our case, you're not doing any client-centered activities, you're not providing services, the risk is, from a planning grant is I don't know of any, so that's good. So we're fine.
Okay.
If your agency requires it for some reason, then, that's a separate issue that you'll have to do.
Okay.
Questions for Gary or the panelists? Do we have a...
Yeah, but they get us if they need.
They do. So we're about 15 minutes over, and with all of the technical difficulties and starting 5 minutes late, we're pretty good. So
I went over.
It's all good. So we are going to thank you all again. And, look for the dissemination of all the follow-up materials and the link to the recording of the webinar. And thank you all, and have a great day.